Welcome to the Estes Park Trail-Gazette Weekend Edition. In this series, we will be bringing you some of the top headlines of the week, followed by a local interview. This week, we hear from Karlye Pope, the inpatient director for Estes Park Health, about her first-hand experiences dealing with treating COVID patients here in Estes Park. But first, our top stories of the week. I'm Jason Van Tatenhove.
And I'm Daniel Sewell. Here's our first story. The Pfizer vaccine has officially landed in Colorado, and healthcare workers around the state have begun being vaccinated. Here in Estes Park, the first phase of distribution should make its way up to Estes Park Health and the Prospect Living Center by next week, if not sooner. As of December 17th, the town had 312 cases and 9 deaths. There have been 61 cases in December, following a November that was the worst in the month virus spread-wise in town, with 134 cases in the 30-day span. There have been 231 outbreaks in the county, with 10 here in our community. Only 2 of those 10 remain active. Fort Collins has had by far the most outbreaks, with 125, followed by Loveland with 53. Estes' 10 puts us third on that list. Larimer County has had 13,284 cases of COVID-19 and currently has 3,722 cases per 100,000 residents, equating to 1 in 27 citizens of the county being infected. The Latinx population continues to be hit the hardest, with 4,307 cases per 100,000. Non-white and non-Latinx have 3,449 cases per 100,000, and the white and non-Latinx population have 2,069. Currently, 1 in every 42 Coloradans are infected. On Monday, December 14th, Colorado Governor Jared Polis welcomed the first shipment of the Pfizer vaccine and even signed for the FedEx package it came in. Many other shipments were received Monday at locations around the state, and the rest of the vaccines in this shipment were delivered throughout the week to providers and administered for distribution to frontline and at-risk health workers who are working with COVID patients on a daily basis, and seniors and staff in long-term care facilities. Also on Wednesday, House Democratic Caucus Co-Whip Representative Kyle Mullica received the Pfizer vaccine at Presbyterian St. Luke's Medical Center in Denver. As an emergency room nurse, Representative Mullica is a frontline healthcare provider with direct contact with COVID-19 patients and is among the first people in Colorado to receive the vaccine. Quote, "Receiving the COVID-19 vaccine today means I'll be able to continue and expand my work in the ER," said Mullica. "It also means that the end of the pandemic is finally within reach. The vaccine is not only safe and effective, it is the cornerstone of our plan to beat this pandemic, once and for all. I'm grateful to all of my frontline healthcare workers who have been on the front lines in hospitals across the country. It's been a long year battling this virus, but the end is in sight." End quote. Next week, the state hopes to receive the first allocation of the Moderna vaccine, pending approval from the FDA. The Moderna vaccine is easier to transport and store due to the fact that it can be kept in a traditional freezer, and nursing home staff and residents will be prioritized to receive doses. Quote, "The more vaccines Colorado receives, the more people in Phase 1 can be vaccinated, and the sooner we can move on to Phase 2, the governor said." End quote. It's still too soon to say what kind of impact Thanksgiving had on the cases in Colorado, but state officials are hopeful that we are seeing a plateau. It appears that the vast majority of people avoided travel, only interacted with their own households, wore masks, and as a result, we are faring better as a state. While the vaccine has arrived, it will not make it to the general public for months, and people are still encouraged to wear a mask, socially distance, maintain their bubbles, and avoid holiday gatherings. It could be that Christmas and New Year's Eve are the last big hurdles to face before weather starts to warm. Vaccines are made more available, and we can start to clearly see a light at the end of this long, lonely, frustrating tunnel.
Postal staff shortages frustrates residents. According to many locals, the Estes Park Post Office has had a history of long lines and slower than average service. Now, the logistical problems stemming from COVID-19 and wildfire evacuations have forced the Estes Park Post Office to reduce its operating hours at a season when the United States Postal Service is counted on the most. We do have employee availability issues due to the impacts of COVID-19, which have reduced our hours to 12 to 5 p.m. We are flexing our resources and working to restore normal business hours, said United States Postal Service Strategic Communications Executive James Borud. Like any other businesses, we are dealing with the COVID-19 pandemic and working with occupational health professionals to minimize and mitigate the impact of our employees and customers. On November 2nd, the post office announced that Estes Park, Drake, and Glenhaven mail returned to the Estes Park Post Office, and mail would no longer be available at the Loveland Valentine Station where it was being kept during the evacuations. Since then, a crushing surge of COVID has hit Larimer County and Estes Park, resulting in the employees that Estes Park Post Office does have taking leaves of absence. Quote, employee availability is also impacted by our updated policies that allow for expanded use of leave. This gives our employees the ability to stay home whenever they feel sick, must provide dependent care or any other qualifying factor under the Family First Coronavirus Response Act, said Borud. Quote, we expanded the definition of sick leave for dependent care for covered employees to deal with the closures of primary and secondary schools across the country, end quote. United States Postal Service says that the organization continues to follow recommended strategies from the CDC for social distancing, for reducing customer contact during delivery and retail services, for the use of face coverings, and for cleaning regimens that protect our coworkers and the communities they serve. And that does not always make for a speedy process. A few Estes Park residents wanted to share their story but wished to have their names concealed. One citizen said, I arrived 10 minutes earlier than the revised Estes Park Post Office lobby time of noon to pick up my held mail from the day before. I waited in a line an hour and a half to get to the window, which had just been worked one window at a time the entire time I was there. Just as frustrating was our street mailbox care, the citizen said. While everyone should expect to have to wait at least a little while for delivery services this holiday season, physically standing in the long lines can be particularly frustrating for many Estes Park residents who are advanced in age. Amazon and other carriers are shipping more packages via SmartPost or SurePost, whereby they carry the packages for the first part of the trip and then takes them to the post office for local delivery. Or, in our case, standing in line, said one citizen. Another citizen reported a litany of issues that seemed to be ongoing. They are losing packages. I had one go missing while I was at the window while they searched without success. The woman at the next window was also looking for a missing package. Aside from this, I have found cluster boxes hanging open and unlocked, one citizen said. Many are drawing parallels between the recent wildfire evacuations and the 2013 flood that also disrupted mail delivery. It's a far cry from when Rob Haas led a convoy of employees over to Grand Lake in their private cars to pick up Estes Park mail from Grand Lake after the 2013 flood, one citizen said. As far as when customers in and around Estes Park can expect a return to normal operations, the United States Postal Service is not ready to say. The process for hiring federal employees is lengthy and includes a background check and drug screening. The post office says during COVID, the process is taking longer than normal, but help is on the way to the Estes Park Post Office. There are a few new hires that are in our system that will be on board soon, and the Colorado District Office is working to find additional employees to send up to Estes for some relief.
For our next story, Reuben Bergsten, the Director of Utilities for the Town of Estes Park, tells us despite the wildfires, Estes Valley's water supply is secure and safe. Since the East Troublesome and Cameron Peak fires burned vast areas near the Estes Valley, some may wonder if they affected our water supply. Wildfires destroy the vegetation that filters snowmelt and rainwater. This can threaten our ability to treat source water and deliver drinking water. As the Estes Valley was evacuating, October 22nd, the town's water division essential staff watched as the East Troublesome Fire progressed towards the Glacier Creek water treatment plant. The Adams Tunnel, which delivers water from the western slope, was already shut down for fall maintenance. This left the Glacier Creek plant as the Estes Valley's only source for municipal drinking water. I made a hasty request to the U.S. Bureau of Reclamation to reopen the Adams Tunnel as Superintendent Chris Eshelman and his staff brought the Marys Lake water treatment plant back online. We have two water sources, one entering each treatment plant. Neither treatment plant can operate year-round, and we are working to change that. We were fortunate the East Troublesome Fire just missed the Glacier Creek watershed. On the western slope, it also spared the water supply that enters the Adams Tunnel, at least in the near term. The long-term effects that follow wildfires on the landscape are still unknown. However, the Northern Colorado Water Conservancy District manages the western slope water and is already contacting stakeholders to develop plans and funding to accelerate revegetation on the western slope to protect source water. For many years, the town's water division has successfully managed the seasonal interruptions to our water supply, but we are no match against the extreme wildfire seasons. The 2015 Comprehensive Water Master Plan identified the need to supply the Glacier Treatment Plant with two separate water sources. We've already started working toward that goal. We have secured new water rights and the necessary real estate. We're seeking grants to support the construction costs, and we anticipate the new source water will be available to our plant within the next 5 to 7 years. Continuous sampling and laboratory testing provide us with the assurance that our drinking water is safe and as high quality as ever. The future addition of a second source of water to the Glacier Treatment Plant will help support the Estes Valley's water security for decades to come. For more information about the town's water division, please visit their website at www.estes.org/water.
For our next story, a contentious nursing home meeting centers around a lease agreement. Estes Park Health has determined it is no longer financially feasible to run its long-term care nursing facility called the Estes Park Living Center. A group of community members is trying to save the small facility by finding a third party to run it. On Wednesday, December 16th, the 7th meeting of the Living Center Alternatives Task Force centered around the amount Estes Park Health may charge to lease the building. Estes Park Health CEO Vern Carta suggested what he explained as a fair market figure of $22 a square foot. Community members balked at the notion. "Where did you get that?" asked Task Force member Peggy Lynch. "That's outrageous. This is so out of line with market analysis I gave you after talking to landlords and commercial appraisers. That's just crazy." Estes Park Health Board member Sandy Begley asked the task force member what kind of figure they had in mind. They answered the price of the lease would need to be $5 to $10 a square foot. "We have worked hard to get you all of the figures you wanted," Estes Park Health Board member Diane Muno stated. "This is a hospital. We are not a competitive landlord. It's hard to separate the health care related activities connected to the building." Estes Park Health Chief Operating Officer Gary Hall explained that there are a host of other components to a proposed lease that are fundamentally inseparable from the property itself, like electricity, water, boiler, internet access, monitored safety system, sprinklers, generators, and paging systems. Some of those components are part of that square foot charge, Hall explained. The group agreed to meet virtually and publicly on Monday, December 21st, to talk about the lease figure in more detail. The population of the Living Center has been dwindling for years and currently sits at 17 residents. Of those 17, 13 are Medicaid patients, Estes Park Health Board Chair David Beatty stated. "This makes it more and more challenging to keep the Living Center open. We are looking at a couple of $1 million we need to find in 2021. Our sense of urgency isn't over." The board has made it clear that the members do not support transferring any of the property tax that supports the hospital district to a third party. "The state has given us a model closing plan," Beatty said. "We feel as if we need to have a plan approved in case we have to close the facility. We're not saying that we're committed to close, but we need to go ahead and have a plan in case we need it. Good Samaritan has indicated it could take all of the residents, if their family chose, in facilities in Fort Collins, Loveland, and Greeley if it came to that. Over last weekend, members of the Community Task Force had an interested third party tour the Living Center without permission from Estes Park Health Administration, a decision that did not go over well. In the middle of a pandemic, no COVID test was conducted in advance of the visit. That feels kind of like a back channel, Muno stated. It feels like a secret. Where's the openness? The board continues to ask for a business plan to make sure any entity that takes over the Living Center could succeed. We have lots of encouraging words, but nothing we have seen gives us the impression that there's something that could succeed, Beatty stressed. The board has a fiduciary responsibility to the community to make sure our money is being spent well. With the continuing substantial loss going on at the Living Center, there is no evidence this is going to turn out well. This is difficult for us. It's a bit dismaying that we're 2 months into this, and when we ask you to share information, we get no answer. The task force indicated they may be able to reveal the identity of an interested third party at a public meeting Wednesday, December 23rd.
In our next article, we cover a workforce housing project that has broken ground in Estes Park. Following a 2-year process, Wildfire Homes LLC has broken ground on their workforce housing project in Estes Park. The project is owned and operated by Rick and Susan Allnut and Mark and Melissa Westover. Quote, "I know many people were wondering if this project was going to happen," said Melissa. "There were times we wondered too. Who could ever anticipate challenges we have all faced over the last year? Yet here we are, ready to build our first building. It's a bit surreal." End quote. The first structures built will be workforce housing units, and eventually there will be 88 total workforce units available to fill a much-needed hole in our community. Workforce housing is restricted to at least one person in the household that works a minimum of 30 hours per week in the Estes Valley. Quote, "We have heard for years that the need for workforce housing is huge," said Rick. "We plan to deliver on that need." End quote. Occupancy and ownership of workforce units are not income-based, nor are the units subsidized in any way. In addition to the 88 workforce units, the development includes 26 townhomes and 14 single-family lots. Quote, "There are no deed restrictions on those properties," said Mark. "However, we have written into the covenants that there will be no vacation rentals. We want the development to feel like a neighborhood where people know and look out for each other," he said. Developers say one of the bright spots in development of the Wildfire Project is the benefit to Crossroads Ministries. Quote, "When we looked at the initial plans, it made sense to offer our current Westover construction building to Crossroads in exchange for their property," said Melissa. "The property Crossroads now sits on will allow for more workforce units and provide continuity in the development. In exchange, Crossroads receives a newer, updated building that better meets their needs," she said. "To us, that was like icing on the cake." End quote. While Melissa and Mark own and operate their own construction company, they will not be contracted to build the new development. Instead, Wildfire Development, Inc. will begin building the project. Quote, "We wanted to separate this project from Westover Construction," Mark commented. "However, those purchasing properties in this development can expect the same high quality we've built our reputation on. Westover Construction will still be going strong, doing high quality custom home building. We have no desire to let go of the business we've worked so hard to build." End quote. The building phase of the project, located across from 1789 Wildfire Road, is expected to take 3 to 5 years to complete. Quote, "Built out of a vision to bring living options to the area's working community with the craft of custom homes, Wildfire's single-family, townhome, and workforce condo options range from bedroom count to customizing your own counters and floors," said Wildfire's website. Those interested in more information can contact www.wildfirecolorado.com or call 970-480-1823.
That was the recap of this week's top stories. And now for our feature interview. We speak with Karlye Pope, inpatient director of Estes Park Health. In a series of articles, the Trail-Gazette has been letting members of the Estes Valley community tell their stories of their own experiences with the pandemic, in their own words. Some of the most crucial people to all of us making it through this disaster are the healthcare providers who care for us if we test positive. Karlye Pope, inpatient director of Estes Park Health, took the time during these unprecedented events to give us a glimpse into what this experience has been like for the nurses, doctors, and healthcare professionals that have been on the front lines since day one. So go ahead and just tell me kind of what's been going on over at the hospital and what your experience has been like.
So when this all started in March, we scrambled, kind of like every other hospital in the United States of America, to get appropriate PPE. There was so much we didn't know, how it was transmitted, who was at risk, how do we take care of people. What do we do if we get overwhelmed and we can't transfer patients to hospitals with the ability to take care of more acute patients? So we pulled together a group of staff, nursing, providers, physicians, anesthesia providers, lab, everybody, and said, okay, what do we need to be able to take care of patients? And we came up with a list of supplies that we needed, and our materials management worked feverishly around the clock and got us those supplies. And then we had what we needed, and then we entered into this 6 months of a weird bubble for the rest of Colorado where we really didn't see a lot of COVID. The vast majority of people that we saw that had COVID, we ended up transferring out to other acute hospitals because they were able to give all of the experimental meds at that time, remdesivir, convalescent plasma. They were working all of the protocols to see what was working. And we don't have an ICU here, and a lot of these patients were ending up in the ICU needing intubation. And the way it took a toll on us, primarily in the emergency department, was you never knew. It's not like you can look at somebody and see that they have COVID, right?
Yeah.
Because you could have a cough, but you could have a cough because you swallowed water the wrong way, or you have a cold. And so all of the symptoms, other than the lack of smell or lack of taste, can be any number of viruses or bacterial infections. So the ED had to really shift into high gear and always be on guard, not knowing who could have it and who couldn't have it. So they all wear eye protection, a face shield or goggles. They wear a mask. If anybody comes in with any signs or symptoms, they're put in one of our negative pressure rooms, which we didn't have when we first started. That was really hard on nursing staff, knowing that we potentially could be taking care of a patient who has COVID and we're sharing an air system with everybody else. Mm-hmm. So when we got the negative pressure rooms, that became a really big priority. And nursing said, we need this, and the provider said, you're absolutely right, and the foundation came through with the money. It was fabulous. So we now have 4 negative pressure rooms in the emergency department and 4 on the inpatient unit, which is a lot for a critical access hospital. We're very, very, very fortunate for all of the work that the foundation did and the contractors who came in and modified rooms to be able to do that. So that added a little bit measure of, okay, I can safely take care of a patient in this room, but how do I keep myself safe? And the other part that really started to wear was, as you know, everybody was told, try not to travel, don't take a vacation. Well, that didn't stop people from coming to Estes Park, right? And so it's a double-edged sword. We need them because we need to keep the economy afloat, but now we're seeing patients from out of state, and they're the ones who have COVID symptoms and are testing positive for COVID. It's not Estes Park people. That was this summer. So, okay, great. Now you're coming here and you're potentially bringing COVID to our community, which we've kept kind of pristine and in this bubble. And people up here really listened and wore masks and socially distanced and really tried to do their part, stayed home. People were really listening to the message, we felt. And then tourists started coming and they were getting sick. And what we started hearing repeatedly was, I didn't believe this was real. I thought this was a hoax. I thought this was made up. I thought that the medical industry was needing money, so they thought this up just to make more money. That was pretty hard blow to take. We don't want people to be sick, but people get sick, so we're here to take care of them. So to be in some ways accused of being a part of some big conspiracy theory, it weighs on your psyche. So this summer we primarily saw COVID patients who from out of state. And we still weren't able to get remdesivir because it hadn't been given emergency authorization. So only hospitals participating in the clinical trials were allowed to have it. So we're still having to transfer patients down. We're not taking any patients on the inpatient side until they've had a COVID swab done. We encountered problems it was probably midsummer where we're running out of supplies because everybody's wanting to swab and nobody can keep up with the supplies that we need. So we were able to find another machine called the Diasorin that tests for COVID, and they were able to get us the supplies we needed, and that's what we've been using. The Diasorin was also purchased with foundation funds, and they're purchasing a second one because the need has been so high. And the unique thing about that is we can turn over a result pretty quickly. The max amount of time that it takes to get a result is about 4 hours, based on how long the machine has to run for a test. But we can test 8. We can put 8 samples in at a time. So that has been great. We're one of the few hospitals in Colorado that is using the PCR method and turning them out results out that quickly. A lot of other hospitals are using the quick antibody test and then following that up with PCR, and the PCR result comes back in 4 days. So we were really our lab director did a marvelous job of finding the machine, the equipment, and then again the foundation came through. So as nursing, we were like, great, we can test people. That's excellent. Now we know who has it and who doesn't have it. But we're still battling conspiracy theories and misinformation and frankly, the politicization of a pandemic, which was not expected at all. So we're riding out the summer. We're doing okay. We're not really seeing a lot of locals with COVID. We're thinking we're okay, and then the fire hits. And as we were evacuating this hospital, we're going to send, everybody has to leave, and they're going to go to the valley, and they're going to end up mixing in with people who aren't wearing their masks and who aren't social distancing and who really just aren't paying attention, and we're going to have COVID when we come back. And that's what happened. We came back, and that's when we really started to see sick people. And we have not been overwhelmed, which is good. But we have a steady stream of patients who have COVID who are needing care on the inpatient side. We all did a cheer when we got remdesivir a couple of weeks ago. It became authorized for emergency release, and critical access hospitals were able to get it. Huge for us that we could actually offer something for patients and not have to transfer them to another hospital. The nurses, the inpatient nurses at first, it took a while to get used to putting on all the PPE, and you have to put it on right, but more importantly, you have to take it off right. And that's a pretty delicate dance. If you've ever put a trash bag on yourself and then covered your face with a mask that's form-fitting, and then put on a face shield or eye goggles and gloves and walked into a room that doesn't have air conditioning blowing, you'll last about maybe 5 to 10 minutes before you are just sweating incredibly. And an average time in a patient room is probably about 30 minutes with patients who have COVID and or suspected of having COVID. There's a lot of things that have to be done, and we group all the cares together so that we're not going in and out of the room. Because the more times you go, you have to put PPE on and you have to take it off, you run the risk of contaminating yourself, and then you can potentially get sick, or you're wasting PPE. And while we have a good amount of PPE, we're all very cognizant that we don't want to run out of PPE. Because at the very beginning of this, we had sewing guilds across the Estes Valley making us cloth gowns out of their scraps of fabric that they use for quilting and sewing projects and those kinds of things, which was very helpful but also kind of scary, knowing, okay, I'm going to go in a room and I don't have an actual barrier to body fluids on. So we now, we're in a good position. We're getting PPE, but we're very cognizant that that could change at any time. The supply chain is very fragile. We're still, we wear a mask for a week unless it becomes dirty, and then we throw it away. Our N95 masks, we get 3 at a time. We rotate them. So if I'm working Monday, Tuesday, Wednesday, I wear one mask on Monday, the second on Tuesday, the third on Wednesday, and then they go into paper bags where they sit for however, a week before they're used again, because it's not like we can get a steady supply of PPE where we can use it for a single day or every encounter and get a new one. So we're still reusing some PPE, and who thought 9 months ago that we would be in the same position? So that's been hard, the big issue is it's a mental toll when you have to wear all the PPE and you have to 100% all the time be cognizant of everything that you're doing, and that you never touch your face, ever. And when you touch your face, we touch our faces all the time. None of us really realized how much we touch our faces until we started watching everybody put your PPE on, take it off. Wow, you just touched your face. So almost all of the nursing staff has gone to a face shield, so you can't touch your face. You can't even get to it. That's helped a lot. This is supposed to be the year of the nurse. And I guess in some ways it has been the year of the nurse, but in some ways it sure doesn't feel like it, because of just the emotional and mental toll always being on guard has taken. And we up here, thankfully, have not been in the same position that other our nurse colleagues across the nation have been in, where people are dying at a rate that they can't keep up, and they're having to ration care. And they have places called the pit, and they put patients who are dying of COVID in there, and 1 or 2 nurses take care of 20 people who are dying. We have not encountered that, and I pray that we never do encounter that, because that's pretty soul-wrenching to do that.
What have you found that you can do self-care-wise or whatnot? How have you coped with the emotional stress?
So we're really so the added stress to that, before I get to your question,
sure.
The added stress has been that there are not enough nurses in the United States of America to take care of the number of patients. So we are now all competing for a single nurse. So if we have a nurse get sick, or a nurse needs to go on vacation, or a nurse just needs a day off, it can be kind of hard for us to do that because we don't have a lot of depth. So what we've really focused on is how can we have fun? How can we have fun? You're working your butt off. I appreciate it. I see it. Somebody tells a joke, and we laugh. We have a CNA who puts up. She calls them the funnies. They're just single-cell cartoons that have a little witty caption about medicine on them, or things like that. That she puts them on the back of the bathroom doors, so you have no idea. You go in there to go to the bathroom, and you see it, and you're like, okay, that's kind of funny. We've really encourage staff. What do you do on your day off? Don't think about this place. What can you do for yourself to build resiliency, to fill your bucket back up? It's been a little hard since you can't go and do anything, but the benefit of being up here is people this summer, they did a lot of hiking and a lot of just being outside. That helped. We're a real close team here. Yes, we work in separate departments, but we all can go help in each other's departments, and that's what we've done. So if the ED is facing an onslaught of patients and all 4 of their negative pressure rooms are full, nurses go down there and they help. Or med-surg is busy, the inpatient side, they come over there and they help. And we're all just pitching in, and we're trying really hard to give each other grace. That some days, if somebody snaps, do you want to take 15 and go walk around the building? And people say, yeah. And they go and walk around the building, and they come back and they go, okay, I can do this again. It's the piece that's the hardest to control for us, because we have no control over it, is no matter how many times people are told, wear a mask, wash your hands, stay 6 feet apart. Don't go visit your grandma and grandpa on Thanksgiving. It's hard, but have a phone call with them, or if they're tech savvy, do Teams or Zoom or whatever, Skype. And people aren't listening. They're not listening, and then we're dealing with the aftermath of sick grandparents or sick moms and dads, and who's going to watch the kids because there isn't anybody else, because everybody else is quarantined. That's been the hardest part for us, is can you just follow 3 simple instructions? And apparently we can't as humans.
How have staffing levels been in Estes Park? I know that's been a big issue elsewhere.
So this has been a trying and challenging year. We're safely staffed. We've changed the model of how we staff on the inpatient side for one thing, which has helped immensely with the staffing. And we implemented an acuity tool, so it helps rate patients on what their level of care need is going to be, so that nurses aren't overloaded with patients, and it can tell us that, we need a 3rd nurse, or we can do 2 nurses and 2 CNAs, or those kinds of things. We started a program, we're piloting a program called a PCT, so that's P as in Paul, C as in cat, T as in Tom. It's a patient care technician. So it's hard to find CNAs anywhere, but it's really hard to find them up here because CNAs don't get paid a lot. Their wages aren't very good. So we came up with, other hospitals have done this, other critical access hospitals have come up with this PCT, and it can be staffed by somebody who's a CNA or an MA or an EMT. And we have, we pulled 3 EMTs who were very willing to trial this, and they help. They're afloat for inpatient and the ED. And they've also supported our swabbing clinic. And it has worked amazingly well. Having them be able to offload tasks and answer the phone and just be another resource instead of helping hands for patients has helped immensely with staffing issues. I'm not going to say that we aren't trying to recruit because we are, but it's been somewhat slow going because, if I want to go work in South Dakota right now, as a traveler, I can get $10,000 a week if I work with COVID patients. And so nurses are saying, I have a lot of student debt. I'm going to go where they have enough PPE, and maybe I'm going to have to take care of the sickest of the sick, but I can do anything for 13 weeks. And so that's what they're doing. They're also leaving the profession.
Yeah.
So we're losing nurses at a time where we don't need to be losing nurses. Colorado's in its worst nursing shortage in its history right now. So we've gotten creative. The directors, like myself, we staff in. Sometimes it might just be for a few things that need to be done, and sometimes it's for an entire shift. Sometimes it's multiple shifts a week. We're pulling together and really trying to support each other in each other's departments.
When are you guys, as frontline workers, scheduled to get the vaccine?
Well, that is a good question. So our CNO and our chief of staff were on a call today with the state of Colorado, the health department. They were determining that. So how many vaccine allotment, what our allotment's going to be, and then when we're going to get it, and then we can work on how we're going to distribute it to everybody. So hopefully they'll have an answer by later today or Monday. We know the vaccine's being shipped right now since the FDA gave approval, so here's hoping that we can get it sooner rather than later.
Gotcha. How is the new treatment? I'm not sure I'm pronouncing it correctly. Remdesivir? Yeah. How have you found that to be working so far?
Well, anecdotally, the patients that we've had on it, we've had to send one patient who had an increasing oxygen need down for a higher level of care, but the other patients that we've had on it have gone home on relatively low amounts of oxygen or on room air. So I don't know, that's anecdotal, but it seems to me and to the other nurses that it's not harming anybody. We do have to check for your liver enzymes to make sure they're not elevated, and if they're not, then you can have remdesivir. If they are, we don't start you on it. But anecdotally, I think it's working, and I think it would be criminal of us to not offer something if we even have an inkling that it would work.
Gotcha. Is there anything else you'd like to add that we haven't covered yet?
Please wear a mask. Please wear a mask. And if you're sick, stay at home.
Alrighty. Well, thank you so much for taking time out of your busy day and everything else you have going on to talk with us.
No problem. Thank you so much for being interested in what it's like being on the front lines.